Most doctors, if you ask them, they don't know how much an MRI costs. They don't know how much a prescription costs. They have no idea. If doctors knew, I think that would change their behavior significantly. Certainly if patients knew, it's going to change their behavior as well. Get everybody involved in the process. And so we're endorsing doctors, hospitals, and I would say now pharmacies as well, publish what things cost so that people have the option of shopping around and asking more questions. And then eliminating antitrust regulations such as START rules and other regulations that inflate costs. For tort reform, somebody asked about that earlier. We believe that there should be specialty boards established to review medical malpractice cases to see which ones are potentially frivolous and toss them out immediately. The loser pays for frivolous lawsuits. I think that would take care of a huge number of issues. So many payouts are made when there really is no fault, just because going to court is so horrendously expensive that people are paid off and they know that that will happen. So there's no barrier to filing a frivolous lawsuit at this point. Cap punitive damages, we're only saying punitive damages. We're not saying pain and suffering, loss of employment, or economic damages. Include physician peers in jury selection. That's not been done. Typically physicians are excluded from all juries. Of course it gets us off the hook for jury selection, but I don't think it's the right thing to do. Docs for Patient Care rejects any government-controlled or sponsored health insurance programs, no matter what name you want to put on them. We've already talked about Medicare, Medicaid. All of those are dysfunctional and bankrupt. Docs for Patient Care also rejects any non-elected government oversight board that will make clinical decisions or determine quality of care and coverage. This isn't a maybe this will happen. This is a this has already happened, and we oppose it, and I'll talk about that later. Other results that we've kind of talked about a little bit. This Obamacare would disincentivize any new development of technologies, drugs, or treatments. Once you put a cap on how much money companies can make, they're going to stop producing. And that's just, it's anti the American way. The American companies right now are responsible for over 90% of the medical and drug innovations in the world, period. And there's a good reason for that, because there's no incentives in other companies for them to do it. Some physicians are no longer accepting insurances. There's got a flyer last weekend from a group down in Highlands Ranch, cash only. We're only seeing 150 patients, and we're going to do quality care, and you pay us cash, forget the insurance company. Now, I don't know of any physicians in Colorado, but there are physicians now that aren't carrying any malpractice insurance, and they just announced that to their patients. And guess what? They no longer have deep pockets. The lawyers go after people with deep pockets, and they're either they're going to self-insure or they're just going to take the chances. So we ask you all to join docsforpatientcare.org. Now, there will be rationing. It's already started with Obamacare. This is the U.S. Preventive Services Task Force. They presented some recommendations on screening mammography. Chances are you heard about it. This came out last November, 2009. I'm just going to flip through some of these quickly because they're more technical. I did this presentation to some physicians, so I changed some things around. But this is a government-appointed panel. This wasn't private insurance. This was your administration, your tax dollars at work. They didn't allow for any public input or peer review of their results before they were released. Deliberations were held behind closed doors, and the most important thing is, according to this MIPPA Act, these recommendations can be used and are being used already to determine Medicare coverage. The panel consisted of 16 members, primary care docs, public health specialists, a few people from the insurance industry, not one single breast specialist, I'm a breast specialist, not one single radiologist, oncologist, breast surgeon, not one single specialist was on this panel. They only used clinical studies that agreed with their conclusions. There were multiple clinical studies that disagreed with their conclusions, and they just ignored them. And they didn't consider any studies that evaluated anything other than death, and I'll explain that in just a minute. So they only looked at deaths from breast cancer. Now they're recommending against screening mammography under 50. Against teaching patients to examine their own breasts. They do no longer encourage patients to examine their own breasts. Against physicians examining patients' breasts. Against screening mammography for women over 74. I know 74-year-olds are in better shape than I am. Against annual screening mammography from 50 to 74. They get it every other year. How am I supposed to find breast cancer? I can't touch a patient. I can't tell her to touch herself. We can't do screening mammography. It's nuts. No, I mean, anybody, it's nuts. How do you look at that and not say, the breast cancer death rate, this is a fact, based on the studies they should have used. The breast cancer death rate has been reduced by 30% since 1990 when we were actually started to do more quality mammography with a low enough radiation dose that we could do it for a larger population. And we've been promoting its use. 50 to 74-year-olds, by only screening them every other year, we'd miss 19 to 33% of cancers that could have been detected by screening mammography. Cancer is more common now, breast cancer. 1 in 11 when I came out of training, now it's 1 in 9, 1 in 8 in Colorado. Younger women get more aggressive breast cancers, are more likely to die from it. Early diagnosis saves lives, late diagnosis costs lives. And obviously the risk of screening is to prevent advanced disease. This panel didn't look at any of this information. We want women to have lumpectomies, not mastectomies. We want them to have lumpectomy with focal radiation of the breast rather than chemotherapy or radiation of the breast, chest wall, and axilla. I mean, you know, we're talking about quality of life, years of productive service to society, and large quantity of life. They didn't take any of this into account with their study. They did recommend changing the screening, making it more aggressive for patients at risk, but this is my favorite statistic. 75% of women diagnosed with breast cancer have no risk factors. 75% have no risk factors. And I can zip through this because I know we're kind of running late on time for me. Women disagree. They said, forget it, we're going to do what we've been doing. We agree with that. The Annals of Internal Medicine, primary care doctors, 60 to 67% said they would abide by the new recommendations. Nuts. Primary care doctors. Avon Foundation, this was a more recent survey, found that 12 states have changed their screening mammography and screening cervical cancer, because you know there's a similar panel for cervical cancer as well. And they changed their recommendations for that. 12 states are changing their programs to comply with these recommendations. Patient screening numbers across town, I can tell you, are between 20 and 50% down. Now, part of that is going to be because of the economy. People have lost in health insurance. They're not going to get mammograms. They're not going to get a screening mammogram without health insurance. We know that. If somebody isn't paying for it, most women won't get it. But it's also because of these recommendations, and that is supported by a different study that I didn't put on here, that a certain number of women are going to change their behavior because of these, because of this panel.
Is there a way to find out docs that are not abiding by the new recommendations? Is there like a website that will?
Oh, say who is and who isn't?
Yeah.
No, you know what? And no, not that I know of. Not
That would
yet.
be a great idea.
Well, and that's just a screening question. You can certainly ask your physician. I want to do this quote and then we'll open up to questions. Allowing a small number of people with no demonstrated expertise in the subject matter to make recommendations regarding diagnosis of a disease which kills more than 40,000 women each year makes no scientific sense and is a mistake that many women will pay for with their lives.